I've worked in the mental health or public mental health sector for 10 years, but I also have a lived experience, so that's added passion, of course. This is my first conference. I would like to hear from the people who have had the lived experience and how that is helping to build the system of care. I'm really interested in the systemic type advocacy and that change.
I work for a community health organisation, and we see a lot of vulnerable people coming through with secondary eating issues is often one of the problems that are coming through. And I've also been working sitting on a group with the Butterfly Foundation for the past year and a half, helping with their LGBTIQ and transgender ways for them to be able to deliver services that are more inclusive for that community. And lived experience. So it's good to just hear where everything's at, and loving the idea of more of a stepped care process and an inclusive, well-rounded, lots of microcosms between a bigger ecosystem type care.
Passion about eating disorders, I guess, as a clinician.
Yeah, lived experience, as well as we both work for Headspace, so national. So
yeah,
just started my PhD on male eating disorders and doing my introductory research about eating disorders in Australia. I came across an NEDC.
I'm doing some presentations tomorrow, which will be really interesting on nutrition management in recovery, and also really keen to hear about the peer support work that's happening at the moment, and the lived experience.
I genuinely wanted to build my knowledge around the system of care because it's not something that I necessarily work with in my role every single day, but it's something that I think is critical to my role in terms of the way that I work with the media.
Our whole team from the Centre of Excellence in Eating Disorders is here today. Great to hear things from a national perspective. Obviously we work really widely across Victoria, but great to hear what's happening on a national level.
And my whole team is here today as well. We're from Eating Disorders Victoria, and I'm the telehealth nurse there, which is basically a sole role in Victoria in the eating disorder community. So I'm here just to try and learn as much as I can, collaborate, network with everybody, and just try and have that sort of collaborative approach to the work that we do.
I work in a few private practices as a dietitian. I've been seeing more and more clients that do present with eating disorders or even just disordered eating, and I wanted to get a better understanding of where I could refer them on where the eating disorder, what we can be doing to better help these clients get through the system, basically.
I've been working for a while with young teenagers, and I guess that many times you find that lots of teenagers start with a body image concerns, lots of internet and social media posts. So they start to feel really down and start to restrict their eating. I also work with a population with children with autism, and as they grow, they have a lot of selective eating. So I started doing a lot of training in this area, and I thought that coming here will actually consolidate and get to form a network with others same like people.
I'm very new in the eating disorder field. So I'm a clinical psychologist. I work principally with trauma and with emergency services. But I guess over the past 6 to 8 months, I've become increasingly aware of how significant eating disorder issues are, how prevalent they are, and I guess I wanted to upskill myself so that I can make some more informed decisions about working with people who have eating disorders as they present, because normally what I've done is I've referred those people out. I'd like to be more informed and able to be more useful in working with them.